Dizziness. I get asked about it all the time, and we've got more and more patients coming in complaining about dizziness. It's very common, it's very disconcerting, and it can leave people feeling very anxious. So if you've got dizziness, this is the video for you. Hi, I'm Dr. Beth, osteopath here at Melbourne Headache Solutions. So if you've got dizziness, book an appointment, speak with one of our experts here to help. We can help you. With dizziness, so many people are coming in and saying, I'm having trouble going into a shopping centre, going into a place like Kmart with all of the fluorescent lighting, supermarkets, driving my car, it's really busy with all of the other cars and the lights going past me, sometimes going into bathrooms with the shiny environment around me, going into crowded areas, and also looking at patterns, so looking at tiles or walls or prints, or even just looking at your shirts is really hard for me to see. So these are really common complaints for people with dizziness. Now, when we're talking about dizziness, we're not always talking about the room is spinning. A lot of people just have this swaying sensation or feeling like they're rocking on a boat. So if this is sounding like you, then this is certainly the video. So other things that happen with dizziness patients is that dizziness also can really bring on sensations of anxiety. So anxiety and dizziness go hand in hand because dizziness brings about this unsettled feeling, this internal unbalanced feeling, and then it increases a sense of anxiety. Now, unfortunately, anxiety tends to also amp up feelings of dizziness, so it brings about this really negative loop for your dizziness. So if you're feeling anxious in regards to your dizziness, don't worry, you are not alone. So in regards to dizziness, what can we do about it? All this swaying, unbalanced sensation around your eyes, you feel like things just aren't quite clear or focused. What is happening? Well, essentially when it comes time for dizziness, then what is happening is that your body is registering that something is dangerous. There is a threat, and your body is trying to tell you that there's a threat by giving you dizziness. It's trying to tell you to change your behavior. So the dizziness is a warning sign that something is wrong. Now, in certain dizziness conditions, then the threat is external. So the outside world, your body is registering as dangerous. But in other dizziness disorders, your body is actually registering that internally, that you are the danger. So essentially what we've got to do in a dizziness disorder is we've got to retrain, recalibrate your brain that there is no threat, there is no danger, and we've got to retrain it, recalibrate it back down so that it doesn't recognize that there is a threat anymore. And then that is when the dizziness starts to drop and disappear, which is fabulous. Now, because we get so much input from so many things, that adds to our vestibular system, which is our dizziness or our balance system, then sometimes we need to work on multiple aspects. So we get so much input from our eyes, our ears, our sense of touch or our proprioception, and we get it from a lot of other places as well. Then we need to work on several different aspects sometimes in order to, as I said, recalibrate that system to get the optimum outcome so that we can get the desired results. But they are definitely there and they can definitely happen. So if you've been watching this video to this long, then this is definitely sounding like you. So that's great. And as I said, there are so many different types of vestibular disorders out there, or dizziness disorders, that they all need to be treated slightly differently. And unfortunately with dizziness disorders, then they are so often mismanaged, misdiagnosed, and sometimes people can be seeing up to 19 doctors or doctor's appointments before they are properly diagnosed. That is an outrageous number. And because the dizziness disorders all need to be treated slightly differently, it is actually very important that you are diagnosed accurately so that you can get the right treatment outcome or the desired outcome. So what is very important is that 1, you get diagnosed correctly, so that 2, you can be treated correctly, so that 3, the danger input is lowered, the perceived threat is lowered, so that the dizziness decreases, so that we're not seeing things like supermarkets or Kmarts or driving or bathrooms or patterns as dangerous, so that we're not seeing them as dizzy, and so that also that sense of anxiety internally or externally is also decreased as well. So if you've stuck with me for this long, then this is definitely sounding like you, and it's definitely something that you're interested in. So, as I said, we are here to help, and so you want to be calling one of our experts. So there is a link above that you will want to be calling, so that you can talk to one of our experts, see how we can help, see how we can help to address your dizziness, and you'll be wanting to book in an appointment with myself. I'm Dr. Beth, as I said, osteopath here at Melbourne Headache Solutions. And if you've got any questions, queries, concerns about dizziness, drop them below. I'm always here to answer any questions that you have. Thanks for listening, and if you found it useful, please share it about with other people, because dizziness is one of those things that people have a lot of questions about, and it's always a bit of a mystery. So please share it about if you found it helpful. Thanks guys, and I'll catch you next time.